So hello, I'm sitting here in the beautiful garden of the Naiminath Homeopathic Hospital and College in Agra, India. I'm sitting with Dr. Pradeep, my guest today for this interview. I came to know Dr. Pradeep in the COVID time through his numerous and wonderful job and he made during COVID time. He became one of the leading experts in the treatment of COVID with homeopathy. And then I made my first interview with this was on this subject. I was very impressed by the quality of his work. That's why I decided later on to come together with a group of Swiss homeopathic doctors to come and to work under his guidance in his beautiful hospital that he set up in Agra, which is a pure homeopathic hospital with 60 beds hospital. And presently I'm again in Agra with a group. In the meantime, I have a great news to announce you, is that Dr. Pradeep will come to Switzerland in April of 2025 to speak on his immense knowledge in the treatment of cancer cases with homeopathy. This he will do during the Congress that SHI is organizing next year in April in Switzerland, with the only subject of how can we best treat cancer with homeopathy. Dr. Pradeep, I'm very happy.
Thank you, me too.
To meet you.
Yeah, very happy to see you again here.
Yeah, this is really always a very enriching experience to be here. Already in these 2-3 days that we were here, we saw so many cases, we saw also many cancer patients. Dr. Pradeep, since when are you are one of the leading experts worldwide in the treatment of cancer with homeopathy. How did this come?
Actually, I passed homeopathy course in 1984, and in my posting in the government hospital in India, 1985, I found few terminal cancer cases, and they have no choice. That time, not much chemotherapy, not much radiotherapy was available in India. So they were just on conventional treatment, just painkiller, etc. So they decided to come to me and I decided to treat them. So it was the first case of cancer stomach, which I treated with the arsenicum album, and it was wonderfully alright. And the lady, I remember this, she survived for 10 years. And this gave me a moral boost. And there were so many cancer patients during 1985, 86, 87. Then I relocated in Agra, where I am. So in Agra I am since 1988, it's almost 40 years here. Here I got a case of pancreas cancer in 1988, and this case was cured within 2 months by lachesis, 30 few doses. And whenever the patient comes, we will try to find out the appropriate antisoric. I always go for the bigger picture, the generalities of the patient, the mental general, the physical general. I treat according to them. And as you know, as you are third time here, we made so many cases cured. Some are not cured. But we have definitely a wonderful work on palliative oncology. We reduce suffering, we reduce the pain, we improve the quality of life. You know, by the chemotherapy and radiotherapy, the quality of life degrades. But with the homeopathic treatment, the vital energy, the vital force get restored, and patient comes to the life. And I am so happy to say that the most of the cases, I feel I have done good for them. And that's why I am very popular here in India, and I am very popular in my area. So lot of people come for the treatment and many people get admitted here, and I am quite satisfied with the progress made by homeopathic treatment only.
This is also most of the patients, as far as I'm aware, most of the patients coming here, they are taking only homeopathy as a treatment.
Yes.
Or are they also currently under chemotherapy plus
Homeopathy.
What are the mainly?
Yeah. There are two type of people. Those who have been under homeopathy treatment for any other illness and they have witnessed the result of homeopathy. Mm-hmm. They are very much convinced that homeopathy is the best medicine for the cancer. Those who are not aware, are not taken treatment for other illnesses for homeopathy, or their experience with homeopathy somehow not good, they first prefer to go to the allopathy, operation, then chemotherapy, then radiotherapy, and lastly they found that they are not getting better anymore. So from mouth to mouth publicity to one patient to another patient, they resort to the homeopathy. And those who come to me, definitely there are maybe 20, maybe 30% of patients who are chemotherapy and radiotherapy, and they are under my treatment also. Currently there are only 3 patients, they are taking chemotherapy as well as homeopathy medicine. And there are so many other patients, they come only for the side effect of chemotherapy. They don't ask the treatment for cancer. They come for the side effect chemotherapy. Once they realize that the chemotherapy side effects we neutralize within 24 hours or 48 hours, then they very much willing to take homeopathy. So on this way I say people are, in India at least, preferring homeopathy for cancer.
Which type of cancer do you treat? Do you have one type of cancer where you say we have too much of this?
No, wonderful. In India, currently we have lot of mouth cancer due to tobacco chewing. Tobacco is a social evil in India. So currently is lot of people having mouth cancer, male, female, both. And the second most cancer occurring in India in women is a breast cancer. In the male, we are currently getting prostate cancer and lung cancer. The lung cancer for the smokers, they have lung cancer, and the prostate cancer, most of the male who had family history of prostate cancer. And some cases we got the gallbladder cancer, long standing gallbladder calculi, one of the reason. Some have liver cancer also, those who are alcoholic, this kind of cases.
Okay. Cancer is on the rise worldwide.
Yeah.
And especially in the last 2-3 years, even more than before. Why do you think it is so? Or did you also observe this in your country?
Yeah, there are few factors. Cancer has too much rising. One is the lifestyle. People have changed their lifestyle. They work late night or they watch the different type of programs in the night. So they can't get up in the morning, so they got the deficiency of vitamin D, and the deficiency of vitamin D is one of the leading cause of increase of cancer. Number 2, in India now people are more interested, the urban people, to order the food on website. So the hot food in the plastic container.
So they don't cook themselves?
No, don't cook themselves. So this hot food in the plastic containers and too much chemicalized, excessive heat causing the cancer too much. So these are the two primary reasons. And as I mentioned earlier, tobacco chewing, smoking, and rising trend of alcohol. Alcohol consumption is increasing year by year in India. So these are the big concern, and these are causing cancer too much.
Doctor, thank you very much for sharing your view on this topic with us. We are very eager to meet you to receive you in Switzerland and to have you as one of our main speakers in this Congress on the treatment of cancer. And Dr. Pradeep will present many fantastic and very impressive cases when he comes to Switzerland to SHI. It is a unique possibility for many of homeopaths to learn from a very experienced and genuine homeopath. And that's why we decided also his lecture will be also available online or in SHI in Zug. So looking forward to meeting you on the 12th of April in SHI, Switzerland. Thank you, Doctor, again.
Thank you very much.